A good afternoon once again to our viewers and those of you listening via our radio outlets. We do want to apologize for that break in transmission, which was due to some technical issues, and we want to thank our colleagues down at Dykes for getting the problem fixed for us. So we are now live. So we essentially are going to start the whole thing over from the beginning. And again, I will start with an opening prayer. Dear Lord, we come before you this afternoon, thanking you for the opportunity once again to meet together to discuss the important issues of this nation. We especially come before you this afternoon seeking your covering hands over our footballers who are overseas at this time representing Angola. And we ask for your mercy and your blessings in keeping them safe and in getting them back safely to Angola. We also bring before you all our healthcare workers, our first responders, our police officers, and all those who are charged with the responsibility of keeping this country safe in the health, law, and other sectors. We ask these blessings in your name. Amen. We just want to apologize for the absence of the police commissioner. He has a previous engagement, but at some point I will give you an update from him. So we now go over to the Premier, Dr. Ellis Webster. Good afternoon, sir.
Good afternoon, Minister Hodge. Good afternoon to listeners and those I'm watching on the different media in Anguilla and throughout the diaspora. Good afternoon to the media and to ministers and ministerial assistants and others participating. I want to say there's a somber mood that hangs over Anguilla today, and that is because several members of the men's national football team have tested positive for COVID-19 in the Dominican Republic and Panama. And we do appreciate the service as they have gone abroad to represent Anguilla. I wish to convey to them and their families that we are praying for the full recovery and a safe return to Anguilla. Also for the health and safety of their teammates who are now in quarantine, and praying that they remain safe and healthy and will soon be able to come back home. There's a press release from the Ministry of Health which I would like to read, and want to say that the health team is not here today because they are busy dealing with other issues, including this weekend and today, where they have been working very hard to with the entry protocols. Especially want to say special greeting to the Chief Medical Officer, and that God bless her as she continues to do the work of this country to keep us safe, along with the other members of the health team. And the press statement reads, June 7, 2021, 8 members of the Anguilla senior men's national football team have tested positive for COVID-19 while overseas to compete in FIFA's World Cup qualifier matches held in the Dominican Republic and Panama. 5 of the 8 positive cases are UK-based players and 3 are Anguilla-based players. All persons are currently asymptomatic. Only 1 of the 8 persons was fully vaccinated. The Anguilla-based contingent, consisting of 18 persons, departed Anguilla on May 18 and was subsequently joined by UK and US-based players and support personnel. As per the protocol, all submitted negative PCR tests prior to travel. PCR tests conducted on the 1st of June and the 2nd of June in the Dominican Republic confirmed 6 active cases of COVID-19. Those 6 persons remained in isolation in Dominican Republic and did not travel with the team to Panama. 2 additional persons subsequently tested positive in Panama on the 4th of June, bringing the total number of COVID-19 positive cases from the team to 8. These persons have also been placed in isolation in Panama. Due to the high-risk nature of the contacts among the team members and additional persons testing positive in Panama, the decision was taken to allow the remaining members of the team to shelter in place and remain under quarantine for a minimum of 7 days. It is understood that the incubation period for the SARS-CoV-2 virus, which causes COVID-19 disease, is 2 to 14 days. Therefore, other members may still test positive. Persons will be retested after 7 days in quarantine and return to Anguilla contingent upon negative PCR test results. Similarly, those persons who have tested positive for COVID-19 and are currently under isolation will return to Anguilla upon completion of the isolation period and recovery from the virus. I'd like to say that in Anguilla at this time, there are no active cases. The last positive case was reported on May the 10th, and today, the 7th of June, completes 2 incubation cycles for the virus. In terms of vaccination update, 9,510 persons have registered, and 9,059 of those have received their first dose, and of those, 5,579 have received their second dose. We're certainly on the right track. However, the vaccine deployment has slowed down significantly again, and we certainly have a target of 70% of the population to be vaccinated and to get herd immunity, which will help to keep Anguilla safe and protect those who can't be vaccinated, such as children, pregnant women, and those who have medical cases which prevents them from being vaccinated. And we certainly would like for those who can be vaccinated, who are eligible, to continue going for vaccination. We did announce last week that due to the need to have at least 6 weeks between doses of the AstraZeneca vaccine, that we have until June the 17th, which is next Thursday of next week, to get the first dose in so that we can get the second dose in before the vaccines that we have expire on July 31st. And so I'm appealing to everyone, for our own health and the health of those around us, and to keep this country safe and to protect those who cannot be vaccinated, that all who are eligible go out and get vaccinated. Thank you, and certainly we'll answer any questions you have in time.
Thank you, Premier. We also recognize that the Minister of Social Development, Honorable Diane Kentis-Rogers, has joined us as well. Just to update you from the Police Commissioner, in the area of community intelligence, he's continuing to ask if you have any information about any border breaches. Could you please email www.gov.ai/911, and please be reassured that it is totally confidential. And he also reporting that over the weekend, the RAPF would have done 26 land patrols to prevent breaches, and inquiries on the few outstanding breaches will be completed shortly. So that is the update from the Police Commissioner. I now open the floor for any questions. Floor is open. So we go over to Felicia Hennis, Radio Angola. Felicia.
Good afternoon. Are you hearing me?
Yes, you're loud and clear.
Okay. Good afternoon, Dr. Webster. Dr. Webster, as it relates to our football players, I take note that the third paragraph says, due to the high-risk nature of the contacts among the team members and additional person, the decision was taken to allow the remaining members of the team to shelter in place. And I know many persons have an issue with this because if those players are negative, is it possible that perhaps they can be chartered in and quarantined at the football stadium? Is that a possibility?
In terms of the high-risk nature of contacts, certainly there are players who they've been all together, and you had 6 that tested positive in the Dominican Republic. The rest of them would have tested negative then. When they got to Panama, 2 of those who had tested negative then tested positive. So it means that there has been 100% exposure. And it is recommended that all who've been exposed, that they quarantine, usually up to 14 days, and then test it out. The health team, given the nature that they're away, has said retest, because we do know that most persons who will test positive usually test positive between 2 to 7 days. And so they'll be retested then. And there is a risk, certainly, of, if you charter a plane to bring them in, there's risk among themselves. And so that's why we ask when persons quarantine that they quarantine away from other persons. And just in case somebody is already infected and just tested negative on the test. And it is also, you expose other persons in that regard. And so that's why if we have a known exposure, it is recommended that persons quarantine or shelter in place until the time has passed, which we did with the cluster. When we had the cluster and we knew there was contacts with positive persons, we had those persons test, even if they were negative, they quarantined, and then were tested again at the end of that quarantine period.
Okay, Dr. Webster, could you tell us what is the story surrounding the AG? It's understood that he came in and there's some allegations that he did not quarantine. What can you tell us as it relates to the facts of this matter?
The facts, as I know them, is that the AG is in quarantine as required by protocol.
Okay, thank you.
You're welcome.
Thank you very much. Are there any other questions?
Hello, I have a question, and unfortunately the hand on my program has disappeared, so I can't raise it. So I'd just like to follow up on the questions about the football players. Could you tell us if any of them are hospitalized? And 2, I know it's still early from the testing, but has the type of COVID been identified or the variant at this point? Thank you.
And as stated in the first paragraph, all persons are currently asymptomatic. And in terms of the variant, we would not know that since these tests are done in different country. As far as I know, the health team has not asked for that information, but certainly if it is done, we would be interested in knowing the type of variant.
Thank you.
Welcome.
Are there any more questions? Alicia, Ennis ready, Angola?
Yes, are you hearing me? Yes, okay.
Yes, Alicia.
Dr. Webster, my question was to the Commissioner of Police. I'm not sure if you'll be able to answer, but it's in relation to our border security. I'm looking at the Executive Council minutes that was just published on the website last week, and it notes that the Commissioner pointed out that the Marine base surveillance is expensive, and he suggested using a 5 observation point on land, which shall be manned 24 hours a day with a drone and an interception boat. So I was just wondering, has the land surveillance started, and what was the cost of the Marine base surveillance?
Well, we know it was very expensive back when this started, Operation Iron Dome last year, to the tune of almost $1 million a month. And I know that this time we would have gotten help from the UK for any additional expenses of up to £250,000. That is why, it is very expensive to have boats on the water continuously, and it's also dangerous to have persons out at night. That's why we appeal to Anguillians, to stay off the south side of the island, to also to report any suspicious movements of boats, because that is a concern we have. So now I don't have the exact numbers as yet, but I'm sure they will be reported to us at the end of the month, because as Minister of Finance, I am tasked with finding the money to pay these things which are not budgeted for, because, each department has a budget. Even though the police come under the governor office budget, it is still paid for by the people of Anguilla. So we hurt ourselves when we do things that cause us to have to expend. So that information, I don't have the specifics, but I know it is expensive. And I also know that the land patrols have never stopped. They continue. The drone has also been functional and has been used to actually see when boats have veered off course, and also those that are trying to come towards Anguilla have been intercepted. We do have the search and rescue vessel, and we have the I think it's the Endeavour, one of those boats which is available for use to intercept. We've also had to rent charter vessels to get immigration, customs, and police out there to turn back vessels that were trying to come into Anguillian waters. So this is why in the beginning the minister said the commissioner wanted or gave the address that persons can email address, persons can send information to, so that we can keep our borders safe, because the most risk we have of COVID coming back into Anguilla is from illegal re-entry.
Dr. Webster, someone just posed a question here to us at the station. They want to know, what is the difference with our negative footballers and the tourists who come in and we don't know who they are in contact with?
The difference is that the tourists that come in with negative tests, we don't know who they've come in contact with. That's correct. And so that's a risk. But in this case with the footballers, we do know that they have been in contact with persons with COVID disease. And so that is, then it's a known risk in this case. And certainly we have to do what is right and what has been keeping us safe so far. This has been the case that we've asked persons, before we opened with our phase reopening in July 31st of 2020 and November 1 of 2020, it was difficult even for Anguillians to come into Anguilla. And that was because at the time we were concerned about the high prevalence of disease in countries outside, and we did not want to take the chance to import the disease. Since then, we have moved forward, to help people get back to work, and we know what that risk is. Persons coming in with a negative test, that we don't know who they've come in contact with, certainly that is a risk. But in this case, where we have known contacts, where we have persons who tested positive in Panama, and then some of those persons tested negative, who then tested positive, in Dominican Republic, some of those persons tested negative in the DR and then tested positive in Panama. So we do know that persons are going through that incubation period. And we have to then weigh the risk of them, turning positive still or still being infected. So those are the reasons why the health team makes the decisions that they make, which I think they've done a great job up to this time of keeping us safe.
All right, thank you.
We go over to Dan William. Good afternoon.
Good afternoon, President. Good afternoon to you. By what means are we in contact with our nationals who are affected in Santo Domingo or in Panama? By what means is the health department here in contact with them?
I don't know exactly all the means of communication. I do know that the Anguilla Football Association is intimately in contact with them on daily and maybe even hourly basis. I met with the Football Association today, the executives, and inquired as to the well-being, and they have assured me that they are comfortable, that they understand the situation, and that they're being taken care of. And that is something that we as an administration will ensure that they are taken care of where they are, and that when things are cleared, they'll come home safely.
Another question. The newscast this morning reported that masks will be worn until June 30th. Is that a certainty?
Masks will be worn until at least June 30th, and that is in the regulations. We do make these decisions, or the health team advises based on the epidemiology and the situation as it is here in Anguilla and elsewhere. And certainly the level of vaccine uptake will determine what protocols we have in place and what changes as we move on.
Thank you, sir.
You're welcome.
Are there any further questions from the press? Okay, if they are not, Premier, your closing comments?
Well, thank you very much, Minister. I know that there was some concern about the plastic vaccine cards, and just wanted persons to know that starting this week, they should be available usually at the electoral office for those who had their second dose the week of April 12th to 16th. If persons have left the island, with the blue vaccination card that was given after the second dose, they certainly, if we can, if there's a photo in the system, so certainly those persons who have a voter registration card, they would have had a photo taken at the time. And those persons, since we're doing this at the electoral office, those persons who have voters registration card, who've been vaccinated, their 2 doses can have that done. Those who have left the country with their blue card If they somehow can verify that and verify the identity, then they can have someone pick up their card. Otherwise, if you don't have a photo in the system at the electoral office, then you have to go in, get your photo taken, verified identity, and verify the details of the vaccination. That is, take the blue card in with you, and then you'll be issued a one of those the plastic vaccination card, like you saw me show last Thursday when we were doing the press release. Other than that, I want to thank everyone for the time and attention. As I said, we're certainly concerned about our Anguillan nationals and residents who are abroad right now, especially our football players. We do expect and hope that they stay safe, and that those who tested positive, that they recover fully, and then that everyone gets home safely. We pray for that, and we look forward to that. So thanks to everyone, the media, the ministers, ministerial assistants, to all those online here in Anguilla and the diaspora, those listening on radio. Thank you. The next conference, since next week, Monday, is a holiday. And also, it is a week of mourning for the passing of the Honorable Mr. Hubert Benjamin Hughes. We will not have a press conference next week unless it's an emergency one is needed. And then we'll start up again the following Monday at 3 p.m. So I look forward to seeing you then. Until then, may God bless you, and may God continue to bless Anguilla.